Hello, I'm Dr. Sugar, your internet doctor, here to continue our discussion on rheumatoid arthritis treatment options. So just what are the different medications used and what are those treatment classes all about? I will go into a lot more detail on this in just a minute. So if you're ready, let's get started with a dose of medical inspiration. There are many different drugs used in the treatment of rheumatoid arthritis. Some are used primarily to ease the symptoms of rheumatoid arthritis. Others are used to slow or stop the course of the disease and to inhibit structural damage. What are the differences between the different classes of medication that are used for RA? Most of these drugs fall into one of the following categories. NSAIDs, which are non-steroidal anti-inflammatory drugs, and these include more than a dozen different medications. Now, you're probably familiar with a lot of these drugs because some of them are actually available over the counter, while others of them are available only with a prescription from your doctor. So I'm going to go through the different NSAIDs, as we call them, but basically that stands for non-steroidal anti-inflammatory drugs. So the NSAIDs are used to help ease arthritis pain and inflammation. NSAIDs include such drugs as ibuprofen, which is the generic name for Advil or Motrin, ketoprofen, which is generic for Actron or Arudis, and naproxen sodium, which is Aleve. And this is amongst others. There are many others in this class. Aspirin is in fact the oldest member in this class of medications, and it has been around for more than 100 years. These medications work well on minor pain, but if you have rheumatoid arthritis and your doctor wants to treat you only with these drugs, you might risk serious long-term joint damage as they will not slow down the progression of the disease. They also have some side effects for you to be aware of, most notably stomach problems. If you have had or are at risk of stomach ulcers, your doctor may prescribe celecoxib or Celebrex. This is a type of NSAID called a COX-2 inhibitor, which is designed to be safer for the stomach. The next class of medications includes corticosteroids. Corticosteroid medications include prednisone, prednisolone, and methylprednisolone. These are potent and quick-acting anti-inflammatory medications. They may be used in rheumatoid arthritis to get potentially damaging inflammation under control, while waiting for NSAIDs and DMARDs to take effect. Because of the risk of side effects with these drugs, doctors prefer to use them for as short of a time as possible and in doses as low as possible. DMARDs, which again is an acronym for the disease-modifying anti-rheumatic drugs. DMARDs are drugs that work slowly, and these drugs are very cool because they actually modify the course of the disease. In recent years, the most commonly used DMARD for rheumatoid arthritis is methotrexate. Methotrexate is actually also a drug used for chemotherapy. But there are also about a dozen others that fall into this category. They include drugs that you may have heard of, or if you have a friend or relative with rheumatoid arthritis, you may be hearing of shortly. So these include hydroxychloroquine or Plaquenil, sulfasalazine, which is azulfidine, and Arava, and azathioprine, which is also Imuran. A person diagnosed with rheumatoid arthritis today is likely to be prescribed a DMARD fairly early in the course of their disease, as doctors have found that starting these drugs early on can help prevent irreparable joint damage that might occur if their use was delayed. Some of these drugs have very serious side effects that can make it hard to tolerate the treatment. As I mentioned before, some of them are actually used for chemotherapy, so there are some nausea and other side effects associated with them. The next class of medications are called biologic agents. This is the newest category of medications used for RA, and there are currently about 6 of these agents approved. They are Orencia, Humira, Kineret, Enbrel, Remicade, and Rituxan or rituximab. So each of these biologic agents, they block a specific step in the inflammation process. So for example, Humira, Enbrel, and Remicade, they block a cytokine called tumor necrosis factor alpha or TNF alpha. And so therefore these are called tumor necrosis factor alpha inhibitors. A cytokine is a molecule that the inflammatory cells use to communicate with each other. So blocking TNF-alpha, like Humira, Enbrel, and Remicade do, it basically cuts the telephone line that has been used to call for backup by the inflammatory cells already in the joint. Pretty cool, huh? So this block, it effectively halts the vicious circle between inflammation, and that inflammation is causing the tissue damage, and then the tissue damage releases more messenger molecules, and then those messenger molecules causes more inflammation, and then that inflammation causes more tissue damage, and this has been going on in your joint, and that's what really causes all the trouble. So it just really puts that to a halt. There are also even newer biologic drugs that block other things in the inflammation process. For example, Kineret blocks a cytokine called interleukin-1, or IL-1. This is another one of the messenger molecules that has been shown to be important in the disease process of rheumatoid arthritis. It also seems like in some patients, IL-1 is actually more important than tumor necrosis factor alpha, or TNF-alpha, for communication between the inflammatory cells. So, some people prefer to talk on a two-way radio to their friends nearby instead of using a regular telephone. In that same way, some patients with rheumatoid arthritis are more or less susceptible to TNF-alpha or IL-1. In these cases, any of the TNF-alpha inhibitors might not work well enough to control the disease, but Kineret, the IL-1 inhibitor, might actually help. Another newer biologic drug is Orencia, and Orencia blocks the activation of T cells. T cells are inflammatory cells that don't carry weapons themselves, but instead they show other armed inflammatory cells what to attack, which in the case of rheumatoid arthritis, the T cell is showing these other inflammatory cells to attack the cartilage in the joint. So by blocking T cells, this leaves the other cells blind, and so therefore they will not attack, and they certainly won't be attacking the joints. That is a good thing. And then finally there is Rituxan, which acts to block B cells. B cells are among the most important armed cells that can directly cause joint destruction in rheumatoid arthritis. Because all of these agents target specific steps in the process, they don't wipe out the entire immune response, as some other RA treatments do. And in many people, a biologic agent can slow, modify, or even stop the disease, even when other treatments haven't helped much. However, you should know that these new drugs still do wipe out an entire part of the immune system, which can make people more sensitive to certain infections. For example, some studies have shown that people who have been using TNF-alpha inhibitors seem to be more sensitive to a recurrence of tuberculosis if they ever had that disease earlier in life. If your disease is treated with these new treatment options early and aggressively, you have a very good chance of going into complete remission. Now, this does not mean that your rheumatoid arthritis is cured, as it is a chronic disease for which no cure exists today. But it does mean that your symptoms could go away completely as long as your medication is working for you. These treatments have also been shown to reduce or even avoid long-term joint destruction and lower the risk of disability. I'm Dr. Sugar, and be sure to watch Part 3 of our series on rheumatoid arthritis treatments. In Part 3, I will discuss the current research that is being done and what scientists are looking to do in the future for the treatment of rheumatoid arthritis. Be sure to watch, and I'll see you there.
Sugar.